Hello, my name is Allison Yates, and I'm the author of Practical AAC, A Guide to Functional Communication. We're going to do a walkthrough of the guide so you can see how it's formatted and how it should be used. It is created in a very simple language so that you, other speech therapists, teachers, and parents can pick it up, follow the guide, and help individuals who are in need of augmentative communication go from cause and effect all the way to phrase building. I'm a practicing speech therapist myself, and let's face it, if somebody gave me this guide, I'd say that's great, and then I'd put it on my shelf, because I don't have time to read everything. This guide is not meant to be read cover to cover, and I think that's the most important thing you need to know. As you'll discover in the PowerPoint that's going to be presented next, you simply open to the first page, and you're going to find out where the individual that you're going to need to be working with, what skill they have. Do they have cause and effect? Yes. And you keep going until you hit a note, and it will tell you what page to start on. And you start there. So it's not meant to be read cover to cover, because let's face it, none of us have time for this. So the format is very similar, which you're about to find out in the coming PowerPoint. And not only does it tell you where the individual is functioning and where to start, there's also a very handy IEP goal that's available. There's a setup, which we're going to talk about a little bit more in depth. And then also, once again, I don't have a lot of time. I have to do things quick. However, I want to do it appropriately. And as is the case, many of us are very, very crunched on time, but we still need to do what's appropriate for our individuals. So, as you can see, when you're referring to right here, this tells you your setup. And in this, it says you can get the pre-made overlays. This is something I've created for you to help you save time but still do what's appropriate for your individuals. So you simply look here. It will refer to what the pre-made activities are. You get the pouch that comes with it. Pull out the appropriate overlays. Slide them into your device. And you're ready to go. Everything you need is here to get you started, make you feel confident, and also provide correct communication for the individuals that you're working with. So without further ado, we are now going to have a little more in-depth walkthrough of the guide.
Okay, so now let's talk about getting started. The first thing you're going to do is go to the starting point checklist. What you're going to do is you're going to determine where your individual is currently functioning. So if you look at number 1, for instance, it says knowledge of cause and effect. Do they understand that if they press a button or they do something, they cry, they giggle, that they're going to get attention? Do they know if one thing causes another? If you check yes, then underneath it says move to number 2. Little or no choice-making skills. If you're not sure, then you'd start there, but if you know they can make choices, then you keep going down. So you go down to number 3. Do they have symbol discrimination? That means, do they understand the difference between a symbol of a chair and maybe a symbol of a ball, or even more complex, do they understand the difference between a symbol of a chair and a symbol of sit? If not, then you would go and go across, you'd check no, and you'd start at stage 2. So basically what you need to do is you need to locate where your individual is, and if you're not sure where they're functioning, then you can go to where you think the individual is functioning. In this case, it's always better to err on the side of caution. If you're not sure if they have symbol discrimination, start there. Don't go straight to intentional device activation and frustrate them. It's much easier to start at a lower level and quickly work your way through and make sure they know it and have that foundation, rather than guess that they're ahead of that point and frustrate them. After you've done the starting point, the next thing to do is to simply turn to the page that the guide directs you to and start teaching effective augmentative communication device use. All of the sections are formatted the same. They all have a performance skill chart, and they all have current levels. They also have a suggested goal. So at the top, the current performance skill chart helps you keep in mind that on the top is regular language development. So even if this child is 7 years old, it'll help you understand better that they really are displaying themselves like a 3-month-old or a 9-month-old, and what that means. And then underneath the line is the AAC Continuum, which is something that I've created that helps you understand what kind of skills they need to know at that point that is associated with that particular language skill that they're trying to acquire. So for instance, this one says that they display a startle reflex, that they're going to visually track, that they're going to auditorily track is where they are functioning as far as language development. And in the AAC Continuum, they need to attend and react to output, which means that once you hit a switch, that they're going to look at or visually track that little toy that's moving. And they also may activate the device with assistance, hand over hand. The current level of performance is going to be what they are doing now. So, for instance, in this stage, it says little or no understanding of cause and effect, because this is the very beginning. No other form of effective communication. They are communicating. If they're using facial gestures, if they're crying, they're communicating, but we're talking about functional, effective means of communication. And then the last thing is a suggested targeted goal. So whether you're in a school system, whether you're in a school system, or if you need something for a therapy plan for your individual, there's a suggested target goal. So for instance, this one says you insert the name, will independently activate a single message device to request desired objects and actions from the caregiver, and then you do a percentage and accuracy rate at that point. So it even has suggested goals for you. The next thing you're going to see is a setup. It's going to give you a detailed way that you need to set up your room and your environment, and also it's going to explain to you how you should start teaching the child at this level. It's going to tell you what kind of equipment you need and what kind of items you need. In a few minutes, we're going to talk about the extra materials, the activities that come with it. That you can use. As you can see down there, it says pre-made symbols. I've already made some symbols for you that are available, so that in each stage you can just pull them out, pop them in the device, and you're ready to go. And then it's going to have a discussion about the environment, how you need to set things up for them, and then your teaching method. At each stage, your teaching method should change. Right now we're doing cause and effect, so a lot of times we're going to be doing hand over hand, and we're going to be helping them press that button. But later on, we're going to do something different. And then we're going to have a detailed activity description, which tells you exactly how to do the activity or do your therapy, how to conduct it, what to do. For instance, this one says you're going to play with the objects, you're going to help them activate it hand over hand, you're going to be doing those kinds of things. So it tells you exactly in a detailed description what you should be doing to carry out that therapy at that time. So it has setup instructions, your descriptions, and then there might be some notes. For instance, this is the stimulus object rule that basically says you don't let the individual play with any of the high interest objects when they're not at the table or they're not during therapy, because then they won't be high interest to them. And you also don't let them play with them for a very long time. And then my favorite part of each chapter is the problem solving. It's the most common things that you're going to run into when you're in each stage. This is done, from what I've run into for years and years, the common things that have happened. So for instance, in the cause and effect area, the problem solving, it says the individual protests and will not allow you to take the item back, because once they ask for it, then you have to give it to them, and then they might fuss with it, and then it kind of gives you some ideas of what you need to do so you can get the item back, so that you can start over that interaction of asking for and receiving. And then, sometimes what your items that you've chosen are too highly motivating. They're their comfort items. Try to stay away from those things, especially with our individuals with autism. If they come into therapy and they have a little car with them, or they have something that they're holding, that's not the first thing that we should be asking for the request. You don't use something that's very, very highly motivating. And then at the end of each chapter, there's a section that says time to move on. It's going to help guide you to when it's time to move to the next stage. Have we completed this stage? Have we mastered these goals? And is it time to move on? So once again, we'll have problem solving, time to move on discussion. And at the end of each chapter, there are charting forms. The charting forms change depending on which chapter that you're in, but they're just there for you to help you out. You don't have to use them. They're definitely not mandatory, but I've just found that they're an easier way to keep track of everything, because with augmentative communication therapy, there's a lot to keep track of all at the same time, including your individual. So this is the goals and objectives, and then your preferred objects, which ones you used, and what kind of prompt that you used, and then down at the bottom of each section, those are your number of trials. So if they properly hand over hand let you press a button, and then you gave them the object, then they get a check because they completed it the way that they needed to at this time. So there's charting forms and examples for each one of those in the back. After you've gotten through cause and effect and you've gotten through choice making, there's also a section that that you can use. It's called Where to Go Next, and basically you're just going to follow the little matrix, and it'll help you think about it on an individual basis. What device, what communication system is better for them to be using at that point? So you need to think about each child or each individual as an individual, and think about what they can do and what they can't do, so that they have something that's appropriate for them. Not something that's new and high-fangled, or it's the best thing for you, or it looks like it's a lot of fun, but something that's actually appropriate for that person and what they need for their communication needs. So this is a little matrix that you just kind of follow to help you decide what's a better type of device for that individual after they get through choice making.
So now we've had a quick walkthrough of the guide. I hope you understand it better, and I hope it's something that will really be beneficial to you, other therapists, teachers, and parents. If you have any further questions, please contact, or you can actually look at some excerpts of the guide on www.amdi.net. Thank you so much for your time.